So if you're someone with dry eye, you might be finding yourself in a more severe category. Maybe you're trying artificial tears and home remedies and treatments, but you're not finding any relief. And you might be wondering, okay, what other options are out there for more of a severe dry eye? Well, we're going to go over some of the best options out there right now. Let's focus in. Now, to lay the groundwork for this video, a lot of times that you'll find in the dry eye world is sometimes the treatment is kind of a step-by-step or a ladder approach to treating dry eye. And this is assuming that you're already kind of doing some home remedies or some baseline dry eye treatments. And this can include eyelid hygiene, making sure that your eyelids are washed and cleaned, that you're doing warm compresses or blinking exercises. It can also include diet or lifestyle changes. This can be increasing your omega-3 intake, using a humidifier, taking breaks from your computer, or this can include using over-the-counter artificial tears or multiple different artificial tears. And so we're kind of building on that foundation of that type of dry eye treatment. A lot of times you'll find yourself still needing to do those treatments in addition to these other treatments that we'll mention in this video for more of a severe dry eye. Now, the first category we want to go over are prescriptions. So prescription to help your dry eyes. Now, we actually live in a golden age of dry eye treatments, whereas I think in 2016 we only had one prescription available for dry eye, and that was Restasis. And now today I think we have 8 or 9 with many more in the works. The first area that we want to talk about are in the category of immunomodulators. And the big medication that's been around for a while there is called cyclosporin A. Cyclosporin A has been shown to reduce inflammation, which is a big component in dry eye. And it reduces or blocks the inflammation chain. The big medications here include the original Restasis that has been around for a while, has been the go-to for many doctors, has a lot of scientific backing to it as well. But more recently, new cyclosporin A medications have come out. This includes Cequa or Clarity C, which has been a compound option for many doctors, and then a brand new medication called VEVYE that has just recently come out this year. And these medications have increased dosages than what Restasis is. For example, VEVYE is double the dosage of what Restasis is. Also, VEVYE is a little bit more oily and has an additive on there that actually makes it stay on the eye longer, so it makes it more effective. Cequa is also unique, where it's almost double the dosage of Restasis, and also has a component in there, a micellar technology, that makes it carry or makes it more effective to actually penetrate and get into the tissue that actually helps with that inflammation. Now, a lot of times what you'll find with these medications is that it takes some time to work, to see some results. For example, with Restasis, sometimes it would take 3 months up to 6 months to actually know if Restasis was going to be beneficial to you. With the new medications that have higher dosages, definitely a lot less. Now, VEVYE has actually been shown that it can start to work or be more active up to 2 weeks, or it might take a month to show improvement. Same thing with Cequa. It can actually take maybe up to 6 weeks. And so nowadays you might see doctors reaching for those new medications just to see if they can see and get results much faster. With all these medications, it's usually twice a day, so it's morning and night, kind of spaced out by 12 hours. And the downside with pretty much all these medications is the price. A lot of times you're going to have a game or a battle with the insurance to get coverage. Sometimes you might not get coverage, or even with coverage, it can still be pricey. For some people, they might even pay up to $500 per month to be on these medications. And so that is definitely something to consider and can be frustrating for the doctor and the patient. Now, there's another medication that we could put in the same category, but it's not a cyclosporin A. This is called Xiidra. Now, the active ingredient is called lifitegrast, but it works pretty similar to cyclosporin A by reducing inflammation by blocking the inflammation cascade chain. It's also taken twice a day like the other ones, but with lifitegrast, it has been shown to actually improve signs and symptoms of dry eye as quick as 4 weeks. So typically works faster than cyclosporin A. Now, maybe some rare complications that people might get from Xiidra. Some people notice some blurry vision right after they put the drop in, up to about 30 minutes. Some people get redness and irritation. Some people actually taste taste the medication in the back of their throat after they put the drop in. But it's pretty rare that that happens, but that is something to be aware of. Also, a downside is the price. Just like the other ones, the price of this, if you don't have insurance coverage, can be $500 or more per month. The next prescription eye drop available is called MIBO, and this recently came out just in the last year or two, and it's 100% perfluorohexyloctane, which is pretty much an oily component. It's almost all oil. In fact, if you feel it, it kind of feels just like a thick oil on your fingers, and it's there to mimic the lipid layer of your tears, the oil layer of your tears, to try and keep your tears from evaporating and drying out. This is a 4 times a day drop, can be a game with the insurance, can be very expensive. Another eye drop I want to mention that's not really considered or FDA approved for dry eye, but it's prescribed for Demodex blepharitis that can cause dry eye. And this eye drop is called Extemvi. Extemvi is a twice-a-day drop, 6-week course designed to kill the mites that might live on your eyelid and eyelash follicles that cause a lot of debris and irritation and inflammation and redness and dryness. And so if that's the source of your dry eyes, which a lot of people it might be, this drop has been great. In fact, I've had really great success for the people that I've prescribed Extemvi. It's actually quite eye-opening when you see the before and after pictures of how much improvement there is to the appearance of the eyelid and the eyelashes. And so don't rule this one out. If you get a diagnosis of Demodex blepharitis, this is a good option for a drop to help those symptoms. The other prescription medication that is not a prescription eye drop is called Tyrvaya, and this falls under the category of neurostimulation. Now, the origins of neurostimulation actually started with something called True Tear, where it actually had these 2 metal prongs that you shoved way up your nose, and you started it and it caused an internal stimulation of stimulating the 5th cranial nerve that talked to the 7th cranial nerve that told the lacrimal system to produce more tears. So it's kind of like a back door to help you produce more tears. Now that has since been discontinued, and now there's something called the iTear 100, which is an external mechanical stimulator to stimulate that nerve. And then there's Tyrvaya, which is also a prescription, but it's a chemical internal stimulator. So you actually, it's a nasal spray that you nasal spray right on the inside of your nose that stimulates that nerve that way. And again, this is a twice-a-day spray. Can be a game with the insurance, can be expensive depending on your situation. But what's nice about this is that it's not another eye drop. It's not something you're adding to your eye. You're not getting more preservatives into the eye or onto the surface of the eye. This is something that takes the backdoor approach and uses a nasal spray. The next option is something called a punctal plug. The puncta is actually a little hole inside of your eyelid where all the tears drain down. Now the idea of a punctal plug is you take a little collagen or a silicone plug, insert it into that opening, and it plugs the drain. So it kind of keeps your tears from draining too much, keeps your tears on the surface of your eye longer. Now these have been around for a while. There are dissolvable collagen plugs that might last 1 week, a month, 3 months, 6 months. There are some permanent options that are usually made out of silicone that you can put in there to just try and permanently block that drain. And since it's been around for a while, does usually have some good insurance coverage, and so you will definitely want to look into that with your doctor. I find myself using these quite a bit. Now, there are some patients that you might not be a good candidate. If you have a lot of surface inflammation and inflammation cells just floating around there, and then you go and plug the tears so that inflammation can't drain, then you keep the inflammation on the eye longer, and so you might not be a good candidate there. You might want to try and clear up the inflammation first before you do punctal plugs. So now we definitely need to talk about in-office procedures for dry eye. And usually when we're talking about in-office procedures, we're talking about techniques or procedures to target meibomian gland dysfunction or help your meibomian glands function better. And the meibomian glands play a big part in dry eye, where nearly 80% of the people that have dry eye symptoms have issues with their meibomian glands. And the idea behind this is if you have poor functioning oil glands, you have poor functioning and poor quality tears. And so we just want to do a treatment to improve the quality of your tears, to improve the quality and functionality of those oil glands. A big category in this one is considered thermal expression or thermal compression. And this is where you actually take heat to the oil glands, heat up that solidified oil, trying to liquefy that oil, and then you compress or express the oil out of those glands so you can clean those glands out. The big procedures you'll find there are LipiFlow, iLux, MIBOFlow, and tear care. And they all kind of do similar things, maybe in different ways, where they're heating up the oil glands, and then you can express that oil out. Another big one that's probably considered in a category itself, and that's called IPL, or intense pulsed light. The idea behind that is similar, where you're trying to help the oil glands. You are heating the oil glands up, and you can do expression later. But with IPL, you are photocoagulating blood vessels, reducing inflammation, tightening skin. And so a lot of times when you find people or doctors that are offering IPL, they're offering other benefits with it as well. They can treat ocular rosacea, they can treat Demodex, they can treat styes or chalazions like bumps on the eyelids. They can even go further as doing spa treatment or help with overall skin and wrinkles and dark spots on your skin. And so this is becoming a popular treatment because not only does it have dry eye benefits, but it has other skin benefits along with it that you can treat. Now with the thermal expression, how often do you do it? Definitely depends on the person. A lot of times it can be twice a year, maybe every 6 months. If you're kind of doing maintenance, maybe you'll do it once a year. So it can definitely depend on the person. With IPL, definitely depending on what you're treating, it can be every 2 weeks, it can be every month. Sometimes people will do kind of maintenance where they do every 3 or 4 months or 6 months. And so kind of depends there on the person and the severity and what they're treating. And price-wise can range as well. Usually insurance doesn't pick up the treatment for this or the in-office procedure, so a lot of times it is cash pay, and it can range, depending on what you're having done, can be between $500-$600 to $1,800 if you're doing a package deal. So it depends. It can even go higher than that depending on the package that they're bundling. Another category in the area of prescriptions are the use of steroid eye drops. Sometimes you might have a flare-up of dry eye. You might be doing really well for a few months, and then all of a sudden, whether it's the weather change or maybe diet or for whatever unknown reason, your dry eye might flare up really bad and you'll get a lot of inflammation, keratitis, dry patches, maybe pain and redness. And sometimes you just need an eye drop to kind of put the fire out, to calm the angry eye down. And that's where steroids come into the picture. So your eye doctor might prescribe a steroid eye drop to use twice a day, 4 times a day, depending on the type of steroid, and might have you use it for a few days up to a few weeks. Now with steroids, usually it is considered a temporary treatment, not something that you usually want to be on for a long time because there are some side effects that might show up. That can include causing specific type of cataracts, can also possibly cause your eye pressure to raise, which would be the worry of developing glaucoma. And I'll put a list of different steroid drop options right here. Some of these are really good. They're considered soft steroids, so the side effects are a lot less risky. One would be Isuvis, which is a 4 times a day drop that's really considered a dry eye drop, a dry eye steroid drop, and so that's one that's been really nice to have. Another option that I think is becoming more popular with many eye doctors, and that's the use of amniotic membranes. It contains a lot of healing factors that when you place and leave it on the eye can actually help that tissue heal itself, reduces the inflammation, and can actually work really, really well. There are a couple different versions, usually a cryopreserved one and a dehydrated version, and you actually put it on the eye and try and leave it on there for about 4 or 5 days as it kind of dissolves into the tissue, so the tissue kind of gets absorbed into the corneal tissue there. And it actually can work really well. Now, while you're doing it, the patient might feel a little discomfort. You know, that extra membrane is on the eye and might have a little bit blurry vision in that eye. And so usually they do one eye at a time. They might do one eye and then, a week or 2 later do the other eye. And really, it can work miracles, it looks like. It's just crazy the difference of how an eye looks that might have had a lot of keratitis, inflammation, maybe ulcers, and then you put an amniotic membrane on there and can look amazing afterwards. Again, I've done a video specifically about that, so I'll put that link in the description. Another treatment that's becoming more popular is the use of autologous serum. Your doctor might have you go do a blood draw, and that blood will be centrifuged where it separates the blood cells with the serous fluid. And in that serous fluid, they can take it and actually make eye drops specifically for you, where you can actually repair your own tears. And so it's designed to be made specifically for your construction of tears. Again, this blood draw does have to be ordered by your doctor, and usually you can get a specific supply made from that blood draw. And then once you use those drops, a lot of times you might have to go get another blood draw to get some more, and they just make tears out of there. But a lot of people have had success from this. Definitely considered a more severe dry eye option or dry eye treatment, and a lot of times a lot of patients have tried many different things by the time they get to that option. Now this one might surprise a lot of people, and that can be the use of scleral contact lenses. Usually when you think of dry eyes and contact lenses, they don't go well together. Well, with scleral contact lenses, they're a really large, hard RGB contact lens. And the idea behind that is the contact rests on the sclera, the white part of the eye, and between the contact and your cornea, you actually fill it with solution. And so while you're wearing that contact, it does two things. Protects your eyes from the exposure, from the air, from your tears evaporating too much. And number two, it constantly bathes your eye in a solution. So your eye is just constantly in a bath. And so it's been really nice for people with dry eyes, especially the people that have exposure, keratitis, exposure, dryness. Scleral contacts can actually work really well, and sometimes that's the only option that works. Now with these lenses, there definitely is more time to be custom fit to these contact lenses, and they can be more expensive. They're not your normal run-of-the-mill contact lenses, so they can actually range up in the $1,500 mark, and sometimes insurance won't cover it either. So that's just something to talk to your doctor about, but can be a good option. From there, you kind of get into more specific categories of dry eye. For example, there's something called neurotrophic keratitis, where you're having nerve issues, can be a very painful condition that's considered dry eye. That's the thing with dry eye, is that there's so many different conditions that are considered dry eye. But yeah, neurotrophic keratitis, there is a prescription drop called Oxervate that helps regrow those nerves. Very expensive drop. I mean, we're talking $25,000 for that drop. But insurance does have good coverage with that. But yeah, so we're kind of getting into the realm of very specific type of conditions and specific type of medications. And one thing that's getting a little bit more common or accepted is a lot of times when you're dealing with severe dry eye, a lot of times you deal with severe eye pain where people can't even function anymore. And so sometimes patients might be referred to a pain specialist for pain management for their eyes. And it might just sound funny, say, hey, I need pain management for my dry eyes, but this is and can be a very severe, debilitating condition where a lot of patients are kind of crippled from it. And so that is definitely an option. And so don't shy away from that. If you're trying a lot of dry eye treatments and the pain is just unbearable, definitely look into a referral to a pain management doctor. Now, like I said, we are in the golden age of dry eye treatment and research that I fully expect and want this video to be outdated by next year. Maybe there are going to be a lot more treatments, eye drops, medications, or research done to the actual cause and specifics of dry eyes, that maybe some of these treatments will be obsolete, or some new treatments will come along that will replace some of these treatments on here. So in that case, I hope to redo this video and update this video when the time comes. But if you have any other questions, leave them in the comments. I know this was a long video. Thanks for sticking with it. Check out my full dry eye playlist and the links in the description for more specific videos and resources. Stay focused.